bringing you the latest information on medicine, psychology, diagnosis, treatment, and prevention. Major medical advances are made each week, and each week the American Health Journal keeps you up to date.
Hello and welcome to this special edition of the American Health Journal. I'm your host, Roger Cooper. In this edition, we'll dedicate the half hour to a common and growing condition, dry eyes. It affects people generally older than 50 and especially postmenopausal women. When you experience dry eyes, it's usually caused by a lack of adequate tears. Your tears are a complex mixture of water, fatty oils, proteins, and electrolytes. This mixture helps make the surface of your eyes smooth and clear, and it helps protect your eyes from infection. For some people, the cause of dry eyes is an imbalance in the composition of their tears. Other people don't produce enough tears to keep their eyes comfortably lubricated. Eyelid problems, medications, and other causes, such as environmental factors, also can lead to dry eyes. We spoke with a full range of eye care specialists to find out the causes, symptoms, risk factors, and the non-invasive treatments for dry eyes. We also learned about a product designed specifically for alleviating dry eyes, a product that gives instant relief for those suffering from this condition. All that now on the American Health Journal. We begin our program on dry eyes with a segment directed to women who've reached either perimenopause or postmenopause, because they are the most susceptible to having dry eyes. Dr. Emma Clay, an oculoplastic surgeon at the Los Alamitos Eye Physicians, tells us how dry eyes is a condition women are more likely to develop because of their age.
So women are more likely to have dry eye symptoms because they're affected by menopause. Menopause can start as early as the late 30s, early 40s, and continue on into late 50s and early 60s. So half the population for a good period of time can really be affected by dry eye. Menopause is due to a fluctuation in the hormone levels, and it's this fluctuation that causes an imbalance in the three components of the tear film, which leads to dry eye.
How does hormone replacement therapy affect dry eye?
People feel differently about hormone replacement therapy. Some physicians feel that it greatly helps reduce the symptoms of dry eyes, and others feel that it doesn't make much of a difference. What we suggest here in the clinic to our patients is that they go on hormone replacement if it's the right choice for them overall. And we just take it from there and we monitor them and we see if perhaps they need additional tears to help with them, with their dry eye.
What is Sjogren's syndrome?
Sjogren's syndrome is a chronic inflammatory disorder where the body actually starts to attack the cells and glands that produce tears on the eye surface itself and on the lids around the eyes. Patients with Sjogren's syndrome typically also have other inflammatory disorders, most typically rheumatoid arthritis or lupus. Patients with Sjogren's syndrome will have dry eye, dry mouth. They can also have dry skin. And so these patients really suffer from dry eye and often need prescription medications.
And what is recurrent corneal erosion?
Recurrent erosion syndrome is a condition of the eye where the outermost surface, the epithelium, is improperly stuck down to the basement membrane. It tends to slough off frequently. So frequently, even the act of opening your eyes in the morning can cause that outer layer to come off. That can cause patients excruciating pain, and it's almost as if they have a major scratch on their eye and they have to go through this frequently until they either find a right treatment that works, either with medications or sometimes these patients need surgery. The epithelium regrows very quickly, often within 24 hours. But this condition is chronic. The treatments are pretty good, but there's few patients that get 100% permanent relief from it. Some patients are able to get by with using standard over-the-counter eye drops. Other patients need more specialty eye drops such as Oasis artificial lubricating tears. When that's not enough, there are actually saltwater solutions which are very, very good for the eyes. And then there are surgical procedures which we actually encourage the epithelium to regrow properly. I think the use of makeup doesn't really promote dry eye. I think dry eye comes from hormone imbalances, from environmental conditions such as air conditioning, which produces dry air, medications that we take, even eye surgeries can cause it, and of course medical conditions. So if you're planning a cosmetic eye procedure, particularly a blepharoplasty or a lid lift, you want to make sure that your eyes are as healthy as possible going into this surgery. For instance, if you have dry eye, you want to make sure that your eyes are as moisturized as possible so that the eye surface is really prepared to undergo the surgery.
Coming up, diagnosis and treatment of dry eye using lubricating drops and plugs. Now you can take the American Health Journal with you. The doctors you depend on for instant information are as close as your mobile phone. So go to ahjmobile.com and get the latest medical information you need.